Alaikum, everyone. Welcome to this month's Meet the Expert series. Jazakumullah khair to everyone for joining. So every month, the Institute of Muslim Health hosts a Meet the Expert series, usually one for professionals geared towards academics, researchers, clinicians, and then one for the general public. So this one is open for the general public. Just a little bit about the IMMH. So the IMMH, otherwise known as the Institute of Muslim Mental Health, is a nonprofit organization dedicated to the core mission, community outreach, research, and education. Our broad vision is the long-term mental health and well-being of Muslim communities supported through preventative interventions and education, which is accessible, culturally relevant, and academically sound. Alhamdulillah, we were so blessed to have Dr. Venus Mahmoodi join us today. She'll be talking a little bit about perinatal mental health among Muslim women, and then inshallah, we'll open it up to you all to be able to ask any questions. You're more than welcome to send me your questions if you'd prefer to remain anonymous, or you can ask during the Q&A portion live, inshallah. So a little bit about Dr. Venus Mahmoodi. She's an assistant professor of medical psychology at Columbia University. She provides clinical care to women across the reproductive lifespan in the Women's and Reproductive Mental Health Program. She's also a clinical researcher in the early neuroimaging, neuroimmune, and neuropsychology lab, where her work focuses on trajectories of prenatal depressive symptoms and neurodevelopmental outcomes. Furthermore, Dr. Mahmoodi teaches graduate level courses in psychology and mentors students in her research lab focused on Muslim women's perinatal mental health at Teachers College, Columbia University. So as you all see, Dr. Mahmoodi is pretty cool and pretty amazing. And so without further ado, I'll open it up or I'll give it up to Dr. Mahmoodi. Jazakumullah khair.
Jazakallah khair, Wafa. Thank you everyone for coming. I was gonna say showing up, but this isn't showing up, this is coming. Jazakallah khair. So there's a good number of us, alhamdulillah. So what I'm gonna do is just give you an overview of this topic area, and then maybe what we can do is have more time for Q&A and discussion if you feel comfortable. So please take advantage of the chat, and once I'm done with my portion, then feel free to unmute and we can chat and explore some of your thoughts. So I'm going to share my screen, and hopefully this time I do it correctly. Okay. Okay, does that look correct to you, Wafa?
Looks perfect.
Amazing. Okay, I'm just going to move this to the screen. Look at. If I'm looking at people's pictures, at least it's looking at something. Okay. All right, then. So we're going to get started. So this is some of this PowerPoint has kind of elements of these pieces in here. We're not going to be able to talk about each and every one of these elements, but at least this is generally how I teach about perinatal experiences. I think it's really important for us to have an understanding of what normative experiences are around pregnancy and postpartum when we're looking at the domain of physical, biological, mental health, psychological and social functioning. And then for us to understand what the risk and protective factors are for perinatal mental health, and then what the actual mental health struggles look like. So I'm going to kind of breeze through some of these pieces, but really emphasize treatment and how, if somebody or yourself are struggling, what types of support might be helpful for any kind of mental health struggles during this time period. So the first thing I wanted to do is define what perinatal means. Generally speaking, prenatal is described as the time of pregnancy. So between 0 and 40 weeks pregnancy is generally known as the prenatal period. And then we also have, after giving birth, we have the postpartum period. And when we bring the two together, we have what's called the perinatal period. This is generally what we see in the literature and in the research, that postpartum tends to be the first year after giving birth. But you'll see sometimes in the medical literature, it's a little bit different. But generally speaking, when I talk about the perinatal period, what I'm talking about is all of pregnancy and the first year after giving birth. And so we're going to start with what's typical biologically, psychologically, and socially. This is a little bit biologically heavy, but inshallah, my hope is that with this overview, if you have questions, then you can ask them when we are in the Q&A portion. So this is just a graphic that one of my students put together that I thought was cute. So here it is. So the first thing we're going to talk about is hormones, and because they do play such an instrumental role in our functioning as women. And generally, the hormonal shifts and changes begin at puberty, and those hormonal shifts and changes end at menopause. And what you see during your menstrual cycle is that there's this constant fluctuation between estrogen and progesterone. And generally, when you're experiencing premenstrual symptoms, say, the premenstrual syndrome, like, oh, PMS, where there's the sore, there's soreness in the breasts, and there's, cramps and all of that. What generally is happening is that the body is really preparing for that menstrual blood to emerge. And mood wise, we generally see kind of irritability and a low mood happening right when the hormone levels are coming down and right before the bleeding happens. Then you can see during pregnancy that both estrogen and progesterone are pretty high, and then at birth they come back low, and then again right after everyone finishes having the children that they intend to have, then you go through that menstruation period, and then menopause, which is when the hormonal fluctuations end. There's no more menstruation. So you can see that across our lifespans, hormones really play an instrumental role in our functioning, in our ibadah, even in the way that we pray, because when we're menstruating, we can't engage in fasting or prayer. And then even after giving birth, the postnatal bleeding, we can't engage in prayer or fasting. And so this is something that our body is naturally doing, and hormones really play an instrumental role in that, and will also influence our moods. So here are a list of hormones. I'm going to just tell you about this. There's a lot of information here, but the first hormone, human chorionic gonadotropin. I'm sorry, it's misspelled. It's not chronic. It's meant to be chorionic. It's a hormone that is essentially, we see it early in pregnancy, and it's when you are taking a pregnancy test. This is where you get this is what the pregnancy test is detecting, and generally it peaks in the first trimester, and then it comes down, and then once someone gives birth, it's no longer in the system, and it's generally associated with nausea. Although now we found that there's a gene that plays a role in nausea and vomiting during pregnancy, but it is influencing nausea and vomiting symptoms and fatigue early in pregnancy. Estrogen and progesterone tend to increase throughout the pregnancy and then drop right as someone is giving birth, and I'll show you a graph very soon about what that actually looks like. And then prolactin is what's really helpful with breastfeeding, and the decline doesn't happen fully until you wean your child off of breastfeeding entirely. So this chart is really important because I'll come back to vomiting and hyperemesis in a second. But I want you to take a look at this chart where you see those HCG levels, that human chorionic gonadotropin, increasing during right here, which is the first trimester, and then you can see the estrogen and progesterone levels being very, very high, and then once the woman gives birth, you can see that the levels come down to baseline very, very quickly. So, your 40 weeks are finished, you give birth, and bam, it comes back down to baseline. And that can have some changes in our moods and how we feel. And, I'll talk about that in a little bit. But, some women end up experiencing morning sickness at various times of the day. Some women are going to experience nausea and vomiting throughout the pregnancy, and this is called hyperemesis gravidarum, but it's not generally associated with HCG. It's typically there's other factors that play a role there. But what I do want to highlight is this: at delivery, you're going to see the significant change that happens with the hormone levels, where they go from that 200% and it pops back down to baseline, which tends to really affect mood. The other hormones I want to highlight are oxytocin, which is the mother-baby bonding, and it allows for kind of this connection between mother and baby, especially when the baby is suckling. And then, we need prolactin in order to have that letdown effect happen, right, when the milk finally comes into the breast fully. And unfortunately, it is highly susceptible to stress. So if we're experiencing a lot of stress with respect to our life or our families, that it can often lead to having lower milk production if that stress persists. So something that I'm always talking to my patients about, making sure that the stress levels are managed, especially when you're breastfeeding early in breastfeeding, because the milk flow is affected by stress levels. Other things that we see, generally sleep changes over the course of pregnancy. So you generally see that, you're sleeping more early in pregnancy, then sleep tends to get less and less. In second trimester, women tend to feel a little bit better and they're sleeping a little bit better. But third trimester, I'm sure if you're already a mother, there's a lot of struggling with sleep because of the discomfort and the heartburn and the baby moving and such. Physical activity tends to change. Some people are able to exercise, some people aren't. Some people are in bed rest, so it makes it a little bit difficult to maintain a level of activity that is healthy. Eating patterns tend to change. Some women are ravenous and they just want to eat so much, and other women end up having uh, low appetite. And then also libido changes. Some women have an increased libido and they want to engage in more intimacy, whereas other women feel a little bit less comfortable with it. But it can influence relationship with spouses as a result. Another big piece that I often talk to my patients about is expectations. What are your expectations of yourself in terms of what does it mean to be a good mother? What does it mean to, take care of your child in the best way? And there's lots of a judgment that comes from society often in regards to mothers. We often, are expected to always be available to our children. There's a lot of intensive mothering that happens. And, generally speaking, whenever, someone's calling from my daughter's school, they're usually calling me. And I'll be like in the middle of a patient session and my husband's at home, like he's just like sitting and, doing he's working, but he's kind of doing his, he's not like in a session. He's just kind of like sitting behind a computer and working, but they tend to call me. And so then if I don't answer in a particular time frame, like, oh, where were you? Your daughter needed you. So we tend to be put on, the expectations that, women have tends to be much more difficult and intense than the expectations that fathers have on them. And then there's just also this idea of having it all. What does it mean to have it all? What does it mean to have it all with respect to our deen, with respect to work, with respect to other circumstances in our life? And then Islamically, right, we have certain expectations that emerge. And what are the expectations that we have as in order to be a good Muslim mother? And oftentimes, when we don't feel good enough as mothers, we might experience a sense of shame. And then, many mothers end up wanting to isolate themselves and not engage in being around other people because they feel that sense of shame of, oh, what if people think I'm not a good mother? What if I'm doing things incorrectly? And the thing is, in motherhood, there's a lot of variability. There's a lot of positives and negatives, so there's really no right or wrong in terms of motherhood, but we feel like there is a standard and it makes it really hard to feel competent as a mother at times. In terms of normative social experiences, relationship satisfaction, so our relationships with our spouses tends to decline early in in our lives. So early after having a child. So when there's a child born, generally between the ages of 0 and 5, we often see marriages really struggling. And the reason for that is that there's so much effort that's being put into, taking care of this child. There's sleeplessness. There's a lot of struggles in that regard. And so it really puts a strain in marriages. And oftentimes it's helpful to really kind of build a strong marriage before having children, but we know sometimes that's not a possibility. But definitely, we do see that marriages struggle after having children. Friendships can change. Sometimes if someone's the first person in their family to have a child, they or the first person in their friend group to have a child, then they tend to not be able to hang out with their friends like they intended to before, and so it creates some isolation. And the other thing that we notice a lot with women is that the likelihood of a woman sharing when they're struggling in their motherhood is quite low. There are times where someone might share something. So people ask me like, "What do you do?" I say, "Oh, well, I'm a perinatal psychologist, which means that I take care of women who are pregnant and postpartum." And that's when somebody will share like, "Oh, I really struggled. I didn't tell anybody, but I was really struggling." And so I feel like many women are struggling during their postpartum time period, but they really don't feel comfortable sharing with their friends, with their family. And so my hope is that inshallah, as we have this conversation, that we can identify like what are some ways that we can decrease the barrier to seeking help. I know we definitely need more Muslim therapists that specialize in this area, but it definitely is a very difficult thing when you are exposing yourself in this way, and it could lead to judgment, which can be really difficult. So now we're going to focus on risk and protective factors. So these are factors that are not going to necessarily predict whether you're going to experience mental health struggles during pregnancy and postpartum, but they're indicators. So if somebody's experiencing, has one of these risk factors, it doesn't mean that you're necessarily going to get sick, but it might be important to check in with, a mental health provider or a general practitioner or somebody to kind of see like, how am I feeling? And, even having conversations with your spouse about whether, additional support is needed. So in terms of, here's that figure again, in terms of biological, if you have a mother or a sister that experienced perinatal distress, then it's likely that you will too. Another factor is epigenetics. So if, in a previous generation, a parent, experienced in really, really intense stress, then the way in which those genes are expressed will be passed down to their children. So if you come from a family where, they're refugees, or if you come from a family where, there was enslavement or some other kind of major struggle, then that might put you at risk of developing some mental health struggles in the future. Hormones we talked about, right? We talked about how you go from these high levels of estrogen and progesterone, and then it jumps down to baseline. And there's a subset of women who are particularly sensitive to these hormonal changes. So it's not the fact that these hormones are going from up here to down here, it's that change that some women are sensitive to. Just like some women experience really severe premenstrual symptoms, whereas other women experience very light premenstrual symptoms. Some women, it's so severe that they are diagnosed with premenstrual dysphoric disorder and they need medication and they need additional supports. So hormones are an indication for, I often like to check in with someone's menstrual cycle if they're looking to get pregnant, to determine if this is a risk factor for them. Sleep is a very important one for the perinatal period, and we know that sleep can often be affected, during the latter part of pregnancy and also postpartum. And so, if someone isn't sleeping adequately, it can lead to developing postpartum depression. Age, generally very, very young people. So someone who's maybe like a very, very young mother, like a teenage mother might experience higher risk. Also, a mother that might be much older, so someone in their early 40s. In terms of psychological, having a personal history of depression and anxiety can often be a risk factor. How well you're able to tolerate the stress can also play a role. And in terms of like, what are your beliefs about how the world works? So if you have a belief that the world is, just really hard and difficult and challenging, then it might be harder to feel good about yourself, and it might lead to feeling a lower mood. And then here we have some social and environmental factors. Sometimes our cultures play a role in it. Sometimes the way in which we interact with our family, intergenerational patterns, if there's a trauma history, the amount of responsibility that you have in your household, all of these factors are going to play a role. In terms of protective factors, we have, one of the most important factors is having a strong social support. And so if someone has, a strong, husband who's really supportive and helps them, if they have, their mother-in-law is really helpful, it really will help this person feel good and really feel a sense of support. But if someone doesn't have a strong social support, it will put them at risk of developing these symptoms. Unfortunately, they will be at risk of developing depression and anxiety. And you can also see that religiosity and spirituality is there, and which can be very protective against developing symptoms. Being more flexible in the way that you think, having coping strategies that support you when you have mental health struggles. So some of the special considerations that we want to take into account is that, with what's happening in the world right now, with respect to Gaza, we see a lot of, we see the genocide happening, we see a lot of the challenges that people are facing, we see wars and refugees and displaced people. And so all of this is going to affect our mental health. And as women, we're often at risk of developing of symptoms because we get targeted for being hijab wearing women, and then acculturation. Like, how well are you adjusting to this country if you're someone who is fairly new to it? The other thing is, like, how do we see ourselves as Muslim women, and how do we see our role? Do we see ourselves as being educated, as being equal to men, as does our menstruation and our postnatal bleeding prevent us from being good Muslims? So these are the things that I think are really important for us to take into account as we explore kind of what it means to be a woman in Islam. And then in terms of Muslims and motherhood, spirituality is really intimately linked with our role as mothers. So when we connect to this role of motherhood, we often want to be like Sayyidah Khadija radiallahu anha. We want to be like Sayyidah Maryam alayhi salam. And there's this ideal kind of picture that we have of what a good mother looks like. And then we also know that there's religious rulings, right, in the Hadith and Quran that pertain to pregnancy and postpartum that are rooted in fiqh and rooted in kind of theology. And then in terms of your own ibadah, right, as parents, as mothers in particular, how do you make adjustments to your religious practice so that you can maintain a relationship with God, with Allah, despite having this additional role of mothering? And then also the religious practices that are associated with the newborn. So like the aqiqah, the shaving of the head, and the naming on the seventh day, that those can often be very helpful practices. They're sunnah, but they can often allow you to connect better with Allah. In terms of mental health struggles, I'm going to go to the baby blues, which many people have heard of. And, we also call it postpartum reactivity. This is something that almost 80 to 85% of women experience after they give birth. And generally, it's something that we see within a few days after giving birth. Like, as soon as that hormone level comes down, we see women experiencing these symptoms of like tearfulness, irritability, anxiety. This is not a mental health disorder. It's just a struggle that emerges because the body's adjusting to those hormonal changes, and tends to resolve by 3 weeks. If this goes beyond 3 weeks, If there's suicidal thinking associated with it, then it is not considered postpartum reactivity or baby blues. Then you would need to seek support from a mental health provider. In terms of prevalence rates, among Muslims, we generally see it between 10 and 50%. In the United States, in my work, we've seen it to be around 28 to 30% of Muslim women experience mental health struggles in the perinatal period. In terms of postpartum psychosis, these are some of the things that we see. This is a mental health emergency, and if there are any thoughts like this that emerge or any kind of experiences, then we encourage people to go to the nearest ER and to seek help immediately. In terms of depression, if someone's experiencing low excitement or joy about the baby, the experience of being a mother feels burdensome, you can't sleep, you feel like the worst mom in the world, you have feelings of never wanting to have children or running away and never coming back, these are often symptoms of depression. In terms of anxiety, there's just the worry about everything. You can't relax, you can't sleep. You're constantly checking on the baby to make sure that the baby's okay. There's these really terrible thoughts about harming the baby, even though the baby's safe. These are rooted in anxiety symptoms. In terms of PTSD, if you have a birth experience where things didn't turn out the way you expected them, or there's a complication that you didn't account for, this can often lead women to experience post-traumatic stress disorder and have memories or dreams that are very distressing, and you avoid doing things that you typically do because you don't want to be exposed to that experience again. And in terms of treatment, the most important thing that I emphasize is basic self-care. So generally when we think about self-care, we think, oh, I'm going to go to the spa and I'm going to lay there and they're going to massage me. But I'm talking about the basic essentials. So, we need to acknowledge that it's really hard. It's so hard to try to sleep when you have this really big belly and the baby's moving and you're trying to sleep and you have heartburn. It's hard, or you're in postpartum and you're trying to sleep and the baby is cluster feeding and, drinking milk every, few minutes and you're just like, so frustrating. But there are, if you Google sleep hygiene, you can find ways to kind of help increase your ability to sleep better and have quality of sleep. Engaging in mindfulness can be helpful. Sleep routine. So having a routine like, okay, I'm going to pray Isha and then I'm going to go brush my teeth and I'm going to change into my pajamas. But that can often be difficult, make things a little bit easier if sleep is difficult. The other thing I want to emphasize here is that generally we get through these really hard sleep times. It will get better. It will, at some point the baby will sleep through the night. It will take some time, but it eventually will happen. Making sure you're eating regularly, making sure you're eating nutritious foods, and making sure you're hydrating. In terms of movement, we know that exercise helps. So if you're able to just do some basic movement, that can often be helpful. Build a strong social network, build a support network that will help you feel good about yourself, communicate with friends and family, identify people who can help with the baby, who can help with chores, someone you can just chat with, and then also create a support network. I mean, right now, Facebook is like the big place where everybody creates community. There are mom groups, there are online mom groups. Postpartum Support International has a lot of online groups that women can join, and it can be really helpful. You can create a coping card for yourself and put reminders on your phone. You can tell yourself this is hard, but it's going to get easy. You can do this. And then diaphragmatic breathing is taking a breath in, three counts through your nose, and then exhaling through your nose again, but exhaling, at a count of 5. So elongating that exhale. And that can be really helpful. Grounding, calling a friend, doing some mindful dhikr, saying subhanallah, and really kind of putting your feelings into it. And then psychotherapy. So if somebody's struggling, reach out to a mental health provider. We have evidence-based talk therapy that can be highly effective. Cognitive behavioral therapy is often very helpful, and a lot of Muslims tend to feel comfortable with that. And then there's other types of therapy that can be helpful as well. There's also spiritually integrated psychotherapy. We have the Khalil Center that provides this type of treatment. We also have Medistan that provides this kind of treatment. So we do have some, systems in place now, alhamdulillah, where we can work with people, work with clinicians who can provide more support within Islamic context. And with that, I'm going to say thank you to my lab. Thank you to the Institute of Muslim Mental Health and Dr. Hamad Hamid for bringing me here. And this is my contact information in case you'd like to reach out. And then, yeah, I wanted to see if there were any questions from you all. And I'll stop sharing so that we can have a discussion. Oh, did that work? No. Okay, I think it worked now. Oh, no, it didn't work. Sorry, I lost my mouse. Okay, now it worked.
Jazakumullah khair. Jazakumullah khair. I don't have any questions in the chat, but I would like to see if anyone would like to ask any questions live or send them in, and inshallah we can start our Q&A session.
Assalamualaikum, I have a question. Will the PowerPoint and the recording for the lecture today be available to us, or will it be emailed to us?
So yeah, we will be emailing a recording, inshallah, to anyone who registered for the event. As for the PowerPoint slides, that's up to Dr. Mahmoodi.
Yeah, inshallah. I'm happy to share. So I'll share that with you with that. You can share it with
Perfect.
everyone. Yeah. Happy to
Sounds
share.
good, inshallah. Does anyone have any questions for Dr. Mahmoodi?
Alaikum. I did send a question into the chat, but I can just ask. My name is Buki. I'm a mental health counselor in New York and New Jersey. I'm just wondering, Dr. Mahmoodi, like, what do you think is the best way for us to get certified? I've been looking at like PSI. So I don't know what your recommendations are.
Yeah, I mean, hi Buki. We know each other a little bit, right?
Yeah.
Inshallah. So the what's interesting about PSI is that they went from having a very basic kind of certification to having something that's like an actual certification where you get you get that title of like or perinatal mental health certification. I would say it depends on what your goals are. So if your goal is to like build a private practice, then it can often be helpful to have that PMHC associated with your name, because you can very easily put that as your credential. But in terms of like the knowledge base, I feel like PSIs is great. There's a bunch of I would recommend trying Seleni, because they have scholarships associated with their trainings. And I think they have it online, but they also have like an in-person one here in the city as well. And theirs is just as good. I mean, I used to teach theirs, and I would say it's comparable. So I think level one you can get from any agency. I think postpartum stress center is also good with Karen Kleiman, and she also has like the art of holding training that she does as well, which is really, really good. So I would, see what's within like your budget, see what, it's just building up a skill. I don't have the certification just because I've been in this field for so long.
Wow.
And it's just something I didn't feel like I needed. But yeah, I would say, because but I'm like teaching people within, to get the certification.
I mean, I work with women who are postpartum, and I do want to work with. So I do have like the private. I have my own clients. I don't work for a practice anymore. So I do kind of like market myself towards that. And then I did see, yes, I saw PSI. Obviously, they have that whole big like wanting you take a test and you become certified. So I guess that could make sense. But as far as Seleni, I'm not sure what's going on with them. I'm very familiar with them. I know someone who works there, and it's kind of declining a little bit. So I'm curious
Okay.
to check it out. Yeah. So it's interesting you said that you taught that. I remember you used to work with them. So I wonder if
Yeah.
it still is like a good resource.
So
Yeah.
the online one is really good, and especially if Christiane Manzella has done if it's her version, it's really
Okay.
good. It's very detailed. Especially
Okay.
her grief and loss is really, really good, and she's the one
Right.
who trained me in that, and I would like that's really good. But yeah, I figured I feel like
Okay.
they're not as their name doesn't come up as often as it used to,
No.
but
Yeah.
their online training I would say is really good. I'm in a couple of them. I look like it's I was like fresh out of grad school when I did them,
Oh,
so ignore
cool.
those. But otherwise,
Cool.
it's a really
Manzala,
good
you
site.
said too?
Zella, yeah, her name is
Okay.
Christiane Manzella.
Manzala. Okay, I'll check it out. Thank you.
Yeah, of course, of course.
Jazakumullah khair. If anyone has questions, please send them to me because I haven't. I'm now getting from people who said they sent them to someone else. So if you can please send them to me, that would be great. Um, so one of our first questions is, what were the spiritual therapy resources apart from the Khalid Center? How can we register with them?
Yeah, I mean, in terms of spiritual, I think Khalil Center is definitely one of them, but also Madistan, the organization that's under Dr. Rani Awad. I'm not sure how many patients they're taking, but in terms of like perinatal specialization, I don't know how many people have that piece. I do see patients, but I have a very limited caseload that I'm seeing through Khalil Center, and generally it's only perinatal cases. So if someone who is looking for a perinatal mental health specialist, you can certainly email me, and I can try to find someone who's a specialist and is Muslim. There's very few of us, but there are some of us available. But in terms of like integration of Islam, I think there's even fewer, and that's a lot of the work that my lab is trying to do, is to try to create some intervention so that we can teach other people to do that, and to integrate more Islam into the treatment of perinatal mental health disorders. And again, there's very, very few of us, so I apologize on behalf of our field for we just need more practitioners and specialists, and so but certainly you can reach out to me and we can try to find someone for you.
We definitely need more of a lot of things in our field.
I know. It's so tragic.
And lots of hope and still lots of barriers. So
Yeah.
another question we got is, Assalamu alaikum, excellent presentation. Jazakumullah khair for it. At times, I have clients who are pregnant but referred for a motor vehicle accident. What you presented is more than enough and very relevant, but I wonder if you had any added thoughts on how I can improve my practice with them.
Well, it depends on, I mean, I think the previous conversation that focused on mental health treatment for practitioners might have been a little bit more helpful, but um, generally speaking, there are treatments that are specifically developed for perinatal mental health. So, there is, adaptations of cognitive behavioral therapy that are for the perinatal population. And there are books that help you kind of do that. There's, adaptations of interpersonal psychotherapy, and as also dialectical behavioral therapy. And I use a lot of psychodynamic treatment as well with my patients. So I think it's, generally speaking, what I find to be most helpful is giving the perinatal population a space to talk, and to talk about what's going on for them and the struggles that they're having. And that tends to be really helpful. I mean, I don't know, like, with psychotherapy in general, we see that all of them are effective. Even sitting and talking to someone is effective without it even being like in a particular modality. So I think with the perinatal population, they just want to be heard. So if you're at least able to provide a space in which your patients can just, be heard, I think that that would be really instrumental to their well-being.
And the person who sent the question wants me to add no time limit. I guess it's
Okay,
a
thank
side
you.
joke.
Side joke. Thank you. I appreciate it.
Someone else asked, how much of perinatal research considers spousal quality of life and mental health outcomes, i.e., depression and anxiety in partners who are experiencing their wives' diagnosis with perinatal psych and comorbidities?
Do you mean like both, like the spouse also having like a perinatal mental health issue, or it would be helpful to like get some clarity. Is that what?
Yeah, assalamu alaikum. My name is Sana and I asked a question. I just was interested in I've been seeing husbands feel lost and helpless and have
Yeah.
what would be bouts of, clinical depression and anxiety because they don't
Mm-hmm.
know what's going on with their wives. They have an idea,
Mm-hmm,
but they
mm-hmm.
don't know how to support them. And I wonder if,
Yeah.
a lot of the things that we talk about is women focused. And then, but
Mhm.
there's also like the spousal, how does that affect these diagnoses and their wives affect the husbands as fathers, as partners?
No, Sana, that's a really great question. We see that rates of perinatal mood and anxiety disorders are almost comparable to women's rates. I mean, they're not at the level of women's rates, but they're pretty high. So fathers do struggle significantly with mental health struggles around the perinatal timeframe. One of my mentors, Sheehan Fisher, he focuses on fathers' mental health. So does Chuck Schaefer, and they have found that there's quite a lot of distress that emerges. One of the things that we've seen is that with women, we tend to be very social and we connect with other women and we get support and we find a therapist. But what generally happens, especially among Muslim men, is that their source of support tends to be their wife. And so when their wife isn't feeling well, they tend to struggle even more. And I saw this a lot, like, with, I saw this a lot with like men who don't have like outside friends, who don't have, kind of other support systems in place. And so when their wives were not feeling well, when their wives were struggling, they tended to struggle a lot more. So yeah, I mean, we definitely are acknowledging. I feel like it's an area that needs to be developed, of course, but it's not an area that I want to develop. So I'm sure that there's all kinds of hormonal shifts and changes that occur with men. And I'm sure that they struggle in very legitimate ways. But again, for me, my focus is on women, in particular Muslim women, but it is a legitimate issue, a legitimate control, issue that we need to address. And yes, they experience symptoms at the same level as women do. So important point.
Yeah, I appreciate that. Thank you so much. And you mentioned two of your mentors who are doing work in that area. And do you think that you could share that in the chat, or
Mhm.
so I could like
Yeah.
follow up with work?
Yeah, so Sheehan Fisher is my mentor. And then I think Chuck Schaefer, I think that's how you spell his name. He also does work on dads.
Excellent. Thank you so much.
Yeah, for sure.
So we do have two more questions that I got in the chat, and I believe someone else might be sending in a question. But someone asks, what is your perspective on hypnotherapy and natural birth?
That's my thought. Honestly, I feel like, I know that some women have expressed that it helps them in kind of managing pain and allows them to have a birth experience that aligns with you know what they want in their birth experience. For me, I honestly I have no preference or say in how someone chooses to go about their labor and delivery and birth experience. What I'm concerned about is, you know, being able to identify, you know, just knowing that there's a lot of different ways that these experiences can go. So what I mean by that is you can have a plan for having a natural birth, you know, vaginal delivery with no pain meds. Like that can be your wish, but we also have to take into account that we're not in control of the process. Ultimately, Allah subhanahu wa ta'ala is, and it might be that you need an emergency C-section, and to just prepare yourself ahead of time. If you need support around that, you know, that's some of the work that we do as perinatal psychologists to help someone kind of prepare for, like, okay, I would like to have this type of birth, and la qadrallah, something happens. You know, these are the other things that might be you know, needed. So whether it's an emergency C-section or whether it's taking on an epidural, you know, it's about what is it that's going to help you and the baby be the safest. So I can, you know, women can choose whatever route of delivery, whether it's C-section, whether it's natural, you know, that I don't have an opinion about that, but I do have an opinion about being mindful about, you know, that there's a whole lot of things that could happen. So you might have one plan, but just being aware that it might be that you need to have alternatives. And so, like, I had a patient who, you know, she was like, I'm going to have a natural birth and it's going to go like this. And I'm like, okay. And I said, okay, so I'm going to be the bad guy and say, if you're not able to have that, what are you going to do? She's like, well, then, you know, then I'll have my husband advocate for me and do this. And I said, well, what if you need an emergency C-section? She goes, then I'll tell my doctor that I need her to come tell me that I need an emergency C-section. And I was like, great, wonderful. You know, make sure to talk to your doctor ahead of time. So yes, she ended up having an emergency C-section, but she was not traumatized from it because there was a conversation that was had before she gave birth. There was a conversation as she was going through labor and needed to kind of you know, have the conversation with her OB about doing the emergency C-section, and then ultimately we processed it, and within, you know, a week she was doing fine. So, you know, like I said, I don't have an opinion about how you give birth. You know, that's between you and your body and the experience. But in terms of, you know, just being mindful that you don't have full control over the process. And, you know, if you don't have control, then, you know, making sure you're having the conversations with your OB to, you know, determine what the safest next steps are for you.
Jazakumullah khair. We do have one more question in the chat, but I wanted to check in with the audience and see if anyone had any questions they'd like to ask.
I just have one question for Venus, inshallah. How are you, Venus? Assalamu alaikum. How are you?
I'm good. How are you doing? Long time no see.
Yeah, that was awesome. Thank you so much. And it's obviously an area that, you know, we think we know what we're doing, but we, you know, we take the basic approach. I was wondering if some of my students can actually, you know, train, not necessarily train with you, but is there any like crash course they could take with you or somehow integrate it into their general training so that it's a core competency?
I mean, we could
Like
maybe we
your
could
lab.
discuss it offline, and yeah, I mean, maybe it's something that we can discuss offline and see if we can develop something for them. I mean, specifically because and my students and I are trying to figure out how to develop, like, you know, like a set of trainings for Muslim practitioners. So yeah, I'm happy to discuss that if that's something that would be helpful.
We're happy to be your subjects. Call us rats if you want, it's fine. Barakallah fiki.
Thank you.
See you next
So
week. Or 2 weeks from now, sorry.
Sorry? I didn't
Now that I
catch what
said
you said.
see you at the conference.
Oh, okay, inshallah. Inshallah. I'll make sure.
conference is less than a week, subhanAllah.
Yes, yeah. Wow.
So we actually are getting more questions coming in. So we do have around 7 more minutes. So I'll go ahead and ask the ones that we have. Someone said, I also wanted to ask about women who are diagnosed with Hashimoto's or gestational diabetes and how to deal with that mentally and what should you expect through pregnancy and after in terms of your mental health.
Yeah, I mean, certainly any kind of diagnosis is going to make, make women at higher risk. Hashimoto's just in general, there is a comorbidity with depression, unfortunately. So, this is where preemptively, being able to see a mental health clinician can be really helpful. I say this and I know it's like, the issue is about finding the right provider and being able to, because that's what we do. We have patients who, they're seeing their psychiatrist who's a reproductive psychiatrist within the women's program, and then they see us, and then, we're just keeping track of how they're doing throughout their pregnancies. And, and then they give birth, we check in with them, and then we start seeing them postpartum as well. So we're in constant kind of, contact with them and checking in with them. And so if somebody has, some risk factors, like, physical risk factors, then it would be helpful for them as they're kind of planning a pregnancy to like start working with a therapist so that, they can take into account the health issues that might or might not arise. But that, for me, that's what I find to be the most helpful. Like if I'm able to see someone, prior to conception and then during their pregnancy, and then postpartum, generally, like, unfortunately, the way that people end up coming to me that way is when after they've had like a stillbirth or like some kind of a pregnancy loss, but then we're able to, kind of prepare them for the pregnancy, we're able to prepare them for the birth, we're able to prepare them postpartum, and we see kind of, minimal mental health outcomes emerge following that. So, I just think that it would be helpful, to get care, as soon as possible if there is some kind of a diagnosis. And any kind of, like, even if I have a patient who had preeclampsia and ended up back in the hospital after 3 days after giving birth, and she developed some of the worst depression and anxiety and ended up having to go into an intensive outpatient program. And alhamdulillah, a year later, she's stable, she's doing well, and she's considering having, another child. So this, even though it sounds really challenging, it is highly treatable. And when people do get the treatment that they need, they get better. So that's our hope, that someone gets the treatment they need and they get better and they can continue building their family as they envision.
Jazakumullah khair. Someone asked, what are the top 3 preventative measures for mothers to take for their mental well-being?
That's a good question. Number 1, social support. Build your social support, build your friend network, your family network. If you have a history of depression or anxiety, start seeing a therapist, or at least, start, learn about yourself, learn about what helps your mental well-being, whether it's exercise or whether it's, connecting with friends, or whether it's, grounding, like whatever coping strategies that work for you, start identifying them early. Number 3, I don't know, see a therapist if that helps. But preventative, I think, really it's about identifying that social support, because it's such a strong protective factor that it tends to help. But in the research studies that I've seen, just teaching, just doing psychoeducation about the process, just learning about, what does it look like when you're, what does struggle look like? There is this thing called the postpartum pact that I can share with everyone. It's basically like a list of questions that couples can share with each other. And what happens is that it forces like the husband to like check in with the wife, like, oh, if you notice that if I'm not acting like myself, or if you notice that I'm doing not sleeping, or if I'm noticing, so I think having those types of conversations with husbands is really helpful. But also, because the husband's at risk, you want like almost like a wraparound service to emerge, where family members come and check in, with the couple in general, and see like, how are you doing, like how You know, like, oh, I'm noticing like you have dark circles around your eyes. Maybe we need to, like, you know, give you a break. So I can certainly share that postpartum pack that, and you know, we can share that with everyone, so that you can use that as a way to communicate with your support networks.
Jazakumullah khair. That would be great. And our final question of the night, in what ways can husbands effectively communicate for their wives during labor and delivery?
Yeah, that's a really good one. One of my my old boss, he introduced himself as doctor, and so everyone took him very, very seriously because he introduced himself as like, I'm Dr. Richardson, and so that was really effective. Um, but I would say start with having community, like having conversations about what you want. So, as you know, what is it that's important to you? What are the must-haves? What are the things that, okay, it's okay if they don't have this. Like, I really want to labor with the ball, but they don't have it. That's okay. Like, you know, that's not a big deal. But if there's something that you really need, to have those conversations ahead of time, especially like if you're, you know, what does it look like when you don't feel well? So, you know, a lot of times, like when women are going through labor, you know, they're going to behave in a way that's not typical for them. And if it's concerning, go get someone, like go say like, I need you to come now, you know, to be very firm and forceful at times, but to really not give up, because sometimes mental, you know, like within the medical establishment, people can be very dismissive, especially, you know, among communities of color, especially among vulnerable populations, immigrants, Black women. They're at the highest rates of you know, mortality and morbidity. And so it's really important to be a kind of not forceful, but to have some energy when you're advocating for you know, for somebody, because you know, if you're not forceful, they're kind of be like, oh, it's not a big deal. Like there needs to be some assertiveness in the advocacy that's given. So you talk about things ahead of time, have a list of things that are absolutely important for you to have. You know, what does it look like when you're not feeling okay? You know, what if there's, you know, if there's anything going on that feels off, um, you know, ask someone to come. So even if you're like in pain and they're like, oh, it's okay, that's normal. No, it doesn't feel normal. Can you please come and take a look? You know, she's saying it doesn't feel normal for her. You need to come. And so to be a broken record and just repeat yourself over and over and over and over until they say, fine, I'm coming. Because that's what advocacy is. Advocacy is about, she's not going to be able to do it, especially, you know, right before like the most intense, right, labor pains will not allow you to speak up for yourself. So you need to have somebody do that for you. So make sure to have those conversations first with your spouse before going into the hospital or wherever you decide to give birth. So, alhamdulillah.
Jazakumullah khair, Dr. Mahmoodi. Thank you so much for sharing all of your wisdom and experience with us. And
My pleasure.
Jazakumullah khair to everyone for all of your very engaging questions. And as a reminder, we do have the Muslim Mental Health Conference next week, inshallah, at Stanford. For those who want to attend in person, there's also a virtual option. You can register for the conference and attend virtually. And so the Muslim Mental Health Conference will be on March 1st and March 2nd, inshallah. And inshallah, we will have a meet the expert next month in March, inshallah, sometime in Ramadan. So please be on the lookout for that as well. And inshallah, if no one has any other questions, and we will wrap it for today.
Thank you so much for having me. This was wonderful. Thank you all for your questions.
Coming.
Thank you. All right. Take care.